Over time, everything fades, including your eyesight. Experts say macular degeneration is common, especially in Caucasian women over 50. Aging is a major cause of vision loss, but lifestyle choices can influence your risk. One simple change is to add certain foods to your diet to help prevent macular degeneration. Garlic is one of the healthiest foods and can treat and prevent many health problems, including poor eyesight. A Harvard study involving over 800 patients found that a high-fat diet significantly increases the risk of age-related macular degeneration. Experts recommend avoiding monounsaturated and polyunsaturated fats found in processed foods like chips, fries, cookies, and prepackaged items. These fats can double the risk of developing macular degeneration. Instead, consuming small amounts of foods rich in linoleic acid and having 2 or more servings of fish high in healthy oils per week can reduce this risk. Oily fish is beneficial because it contains docosahexaenoic acid, DHA, which supports the blood vessels in the retina. DHA is highly concentrated in the retina and helps decrease the risk of macular degeneration. A Tufts University study involving over 4,000 people found that those who consumed white rice, pasta, and bread had a higher risk of diabetes and macular degeneration. About 20% of these cases could have been prevented by reducing processed food intake. Garlic also affects platelet function, acting as an anticoagulant to prevent blood clotting without thinning the blood excessively. Regular eye checkups are crucial for early detection and prevention of vision problems. Garlic is beneficial for cardiovascular health, reducing triglycerides and total cholesterol by 5 to 15%, and preventing plaque buildup in arteries. It also helps lower blood pressure by affecting the function of angiotensin II, a protein that contracts blood vessels. Incorporating more garlic into your diet can help keep your eyes healthy. Add it to soups, stews, and salads, and eat it raw to maximize its benefits.